Good morning, everybody. I hope you're well, and it's lovely to be back in this beautiful room. So for those of you who don't know, I'm the in-house counsel for the Mental Health Commission. I'm secretary to the board, and I also have responsibility for the Mental Health Tribunals team. So I'm going to be bringing you through the 5 strategic priorities for the Commission over the next 5 years. Before doing that, there's just a few things I wanted to note. And the first is that, as you will see from the strategic plan, the Commission's mandate is based on its legislative functions. That's both the Mental Health Acts and the Assisted Decision-Making Capacity Act. The strategic plan is then based on those current legislative functions and also the ones that we are hoping will come along the line in relation to the amended Mental Health Act. Embedded in the work of the Commission and in the strategic plan, you will see a theme, and that is equity and parity for those people with mental health issues and those requiring decision supports. And it is a theme that we've had coming from the last 2 commissions right through, and it's great to see it so in the forefront of this strategic plan. The Commission is realistic that the plan is very ambitious and there are going to be challenges. And there are going to be a number of challenges, and chief amongst them are, firstly, post-commencement of the DSS, because everybody or anybody here in the room who has been involved in setting up a new service knows there's a huge amount of work going into setting up the service. But then, no matter how much effort you put in, there's always these unforeseen issues that arise. We're fortunate that our Chief Executive has done this and is going to be able to give us a bit of benefit of his experience, having done it in the Charities Regulator. The other big challenge is, of course, going to be the amendments to the mental health legislation, because there, again, the legislation is adopting a more person-centred approach, and the changes are going to be very varied, from changing the criteria for detaining a person involuntarily, but also the expansion of the regulatory function. And we know that that is going to be difficult to work out. There's going to have to be input from the services, as the regulator with the department. To date, we have had a very collaborative approach with the department. We might not necessarily agree on every issue, but we've had great discussions. I suppose in relation to meeting those challenges, the Commission is very fortunate because it has a really enthusiastic and passionate workforce, and you can see that with the DSS team over the last number of years, and particularly the last 6 to 9 months. The work rate that they have put into producing codes and forms and inputting on regulations has been enormous. But we've also seen it on the regulatory side, the huge amount of work that has been put in terms of focused inspections and monitoring and compliance, and with the CAMs. So it's that enthusiasm that will help the Commission reach its goal in achieving its strategic objectives. So the first strategic objective is to continue to be the leading voice in relation to mental health services and assisted decision making. Now, in the strategic plan, which you'll have got a copy of, it sets out a number of actions, aims, and what success means, because we need to know what our end goal is. And in terms of this strategic priority, we want to make sure that we implement the Commission's legislative mandate. But we also want to input in relation to the changes required to both the mental health legislation and the capacity legislation. And aligned with that is any changes that are beneficial in relation to other legislation. So, for example, recently we were asked to make a submission in relation to the Consumer Protection Code, and it has a whole section on how to deal with vulnerable clients. And this is particularly relevant in relation to the commencement of the DSS. And we've urged them to adopt a modern approach and not a paternalistic approach. And they are coming from a very different background and thought process. Similarly, we are going to be making a submission in relation to the public sector equality and human rights duty of care. So that's and just to explain that the Commission has embedded that duty into its business plan and its budget. That's how seriously we're taking that duty. So in terms of success, what does success look like? Well, success is that we've ensured a rights-based approach to service provision, so that in 5 years' time, rights-based approach will just be the norm. and that it will be in people's psyche and culture. The other is that we have taken action and reported where we found people's rights to use services were being infringed upon and threatened. And this, again, relates to both sides of our house in terms of the mental health side, in terms of our regulatory function, taking action where there's non-compliance. On the DSS side, it is to make sure that those who are providing decision or assisting with decision support arrangements or the actual decision support arrangements, that they are closely supervised, and if there's any complaints in relation to them, that they're properly investigated. The second strategic priority is effective and accessible communication and engagement, emphasising and promoting the voice of the person. And you'll have heard from both the Chief Executive and the Chair that the voice of the person is integral to this strategic plan. And again, you'll see it in the legislation, in the DSS legislation and in the forthcoming Mental Health Act, that is really coming out. So one of the actions is to identify and target gaps in public, person and service provider awareness with bespoke and accessible communication initiatives. I suppose one thing that we've learned over the last number of years is that one size does not fit all, and that we have to be more bespoke in terms of our communication. And the evidence, so what will success be? Success will be that the voice of the person has not only been heard, but has been recognised and is promoted and forms part of what we do. Now, a point I just wanted to note here is that the DSS has 2 functions in relation to promotion and 5 functions in relation to the provision of information. And the legislator who put that into the legislation should be complimented, because it really brings the focus back on the individual. What is the individual told? And it's really, I suppose, a human rights focus that people didn't even think weren't aware of. And we hope other legislation will adopt that approach. So the third strategic priority is to continue to drive standards, improve quality and safeguard persons in relation to mental health services regulated by the Commission. And as you've heard this morning, we hope those services that are regulated by the Commission will be vastly expanded. So in terms of actions, what we want to see is set evidence-based standards and develop guidance to improve delivery of services and the person's experience in receiving the service. So we have to look at both. And then in terms of success, we've identified and communicated key areas for action by the relevant parties, either the Department of Health or so forth, and that there is clear evidence-based data to show that there has been improvement in the delivery of service and the person's experience. And one thing we just wanted to recognise this morning is that up to now, the regulatory team in the Commission had been carrying effectively 2 functions. They've been doing all the regulation, the monitoring, compliance and registration, and they'd also been dealing with standards. So they put a business case into the department to get 2 people, 2 posts specifically dedicated to dealing with development of standards. And we want to thank the department this morning for sanctioning those posts, because it's a great departure and it's super timing with the new strategic plan. So in terms of the fourth objective is to promote and support assisted decision making in society by embedding the decision support service as a respected public service. So the actions are really linked to a number of the functions, but I suppose the first is to uphold and protect the rights of people who may need support and decision making about their personal welfare and or property and affairs. And I challenge people in this room, if they don't know somebody within their own family or slightly wider circle who is going to need this support. I know I have it directly in my own family at the moment. So it's hugely important. And then I suppose what we want to see as success is that the Commission has successfully transitioned from the project phase to the commencement to operational. And as the demand for the services increase, is that we will be able to respond appropriately. And one of the other ideas of success is that in 5 years' time, that society in Ireland will be aware of this service. We'll have more people that will have completed their EPAs. We'll have more people who will have completed advanced healthcare directives. We'll have less people going to the courts for orders, and there will have more people using the lower tier arrangements like co-decision making agreements. Our last strategic objective is to be an effective, cohesive, transparently governed and agile organisation acting in the public interest. And just a point that I want to note there is transparently governed. The Commission is very conscious that we're regulating other services, and we're commenting on their governance, and we're supervising people, and we're commenting on their management. So the Commission is acutely aware that its own governance must be up to speed, and that's one of my roles in the Commission in assisting the board and the other members of the SLT in that regard, and we have set that out in the actions and successes. So one of the things is that the Commission remains responsive in relation to issues that arise and challenges that occur, and that we are able to deal with those, and that we also continue to develop a service that is accessible and inclusive, because that again goes back to the fundamental goal of parity and equity for everybody. So our success will be that we have ensured that the standards in accessibility and inclusivity, both within the organisation and externally, are there, and also ensure that the voice of the person is represented and heard at all levels of the organisation. And you will have heard our chairperson, and he has spoken about the initiative which the Board of the Commission introduced a number of years ago, where stakeholders come in and they speak to the Commission, and they either come in 3 or 4 or 5 times a year, depending on other commitments. And it is really the best way of getting the message across, is having the person who's has the mental health issue or has the capacity issue speaking to you. So one last thing is that just to echo again, that in achieving all of this, we're very lucky to have a motivated and passionate staff. And with them, we hope that we'll be in a position to achieve these strategic priorities. Thank you.